Principal sir, good morning, sir.
Hello, good morning, Dr. Premlata. I'm just waiting for them to join.
Sir, I have joined as one name now, sir. Professor Samuel K. Samuel.
Okay, then you please. Yes, you are done it. You are done it. Okay. I think
Is it
I'm.
correct
Yeah,
person
correct,
only,
correct,
no?
correct,
Yeah.
correct. You are right.
Okay, sir. Okay, sir.
Okay.
Thank you. Dr. Bhaktini, madam, good morning.
Hello. Yeah. Dr. Batmini, good morning. Or rather,
Can you hear me?
yes. So maybe
Excellent. Andrea is trying to join as well. We are on the phone connecting to each other. Let me know when you connect, Andrea.
So now anyway, you're connected. Andrea also has joined.
Yeah, Andrea.
Sir, let me make her as co-host so that let share the screen and check, sir.
Okay.
1 minute. 1 minute.
Yeah, no problem.
Yes. So Dr. Batmini, if you just like to check your screen sharing, you can do that now.
Yeah, that's what I want to do. So now let me go on to this is just give me a minute. So what am I supposed to do here? Go full screen. Yes. So I'll do share screen and then should I reduce it or?
Okay. Yeah, so maybe first you can share screen, then I think you can after that reduce it. That's better.
Okay.
Dr. Premlata, you can add Sureka. Can you see somebody, Sureka?
I'm getting disable share screen of participant.
Yeah, participants, only if you like them to speak, they will, the host will unmute them or, they will add them to the panelist.
Okay, so I have switched my PowerPoint on.
Is it? Okay.
Wait, let me try again. So that's on my screen. Yeah. I'll go back to.
Your audio is very clear, Dr. Padmini.
Oh, that is such a relief.
Okay. Yeah. Good evening. Yes. So now you are visible, you are audible. Good morning from here and good evening to you.
Yes, yes. Thank you. Thank you.
Okay, so thank you so much for joining us.
Not at all. Not at all. I'll just share screen and check, sir.
Yeah, please do. Andrea also has joined. Then we'll add her in the panelist list. Has she joined? Any idea?
She is on the.
She's.
Can you see her?
I'll check. Okay,
Can
you
you see
please.
my?
Yes,
Can you see my
that,
screen?
yes, we can.
Yes.
Okay, and now what I'll do is I'll just make it bigger. So it's on this mode, yeah?
Correct. Done. It's clear.
Okay, so what do I do to get out of this now? Stop share on top?
Yeah, stop share. You can stop share. Yes. Okay. So now, yeah. So your face
Andrea, I think I can see Andrea's name. Can you hear me, Andrea?
Yes, I can.
Okay. So has she logged in with her name, Andrea only?
Yes.
Andrea, have you? Yes, you are added. So
can I see you, Andrea, just to get clarity?
Yes. Let me just.
So we can say hi to. There you go.
Hi.
So this is Andrea, Robert. Can you see us?
Yeah, yes.
I think you're freezing a bit.
Okay, done.
Oh, good.
Good morning.
So, yes. So we are all connected now.
That's good. So Andrea.
Good evening, Andrea. Good evening.
Good evening.
Joining us.
Thank you. I'm sorry, it's cutting out a little bit.
You've got your water with you, Andrea? Because it's a long presentation, so we're keeping up water and everything ready.
Got yours, Patty?
Okay.
So I shared screen with Robert. That's working, Andrea.
Perfect.
Yes, so everything is fine. Dr. Premlata, can you add Mrs. Sureka? Dr. Premlata, can you add Mrs. Sureka?
Yes, good morning.
Hello.
Good morning.
Yeah. Yes, Sureka, done.
Am I audible?
So you have joined.
Yes, audible.
Yes, thank you.
So,
Robert sir, your voice is breaking.
my voice is breaking. Okay. Hello, good morning. Is it clear, Dr. Premlata, now?
Yes, sir, it's now clear. Now it's clear.
Okay, thank you.
So once the formalities are over, Robert, then I'll share screen, we'll do our presentation, then I'll come out of the screen for question answers, yeah?
Yes, madam. Yes.
Okay.
I will read out the questions, whatever that is there in the chat box. You can answer to those questions,
about around 11:10 here.
Okay, that's a good plan, Premlata. Thank you for that.
Andrea madam, are you going to share any screen, ma'am?
No, only Padmini.
Am I audible, Dr. Padmini?
Yes.
Yes.
Yeah, audible. And what we have done, we're doing a combined presentation. So I'll share screen and we've done a rehearsal. So as Andrea talks, I'll operate the screen.
Okay, ma'am. Okay.
Yeah, just to avoid confusion. Yeah.
Hello, ma'am. Good morning.
Good morning,
Yeah.
Samir. How
What's
are
the
you?
time, doctor?
Meeting after a long time.
Yes.
Though it's an online meet. Yeah.
Yes.
Okay,
Lovely to see all of you,
yeah,
familiar
sure.
faces. So I heard that Matthew is also going to join today.
Okay.
You've had really good responses.
Yeah, yes. And the last 2 days it went on very well.
Excellent.
And today also it's going to be the same since we know you.
Thank you.
Yeah.
So nice to see familiar faces. Yeah, and I'm super excited that Andrea has joined me too.
Okay.
Yeah, she's one of my star students. If I have to pick one, it's her.
Okay. Yeah.
I was telling her after the virus is on all over, everything settles, we'll make a trip to Brahmavar.
Ramu, you are welcome, ma'am.
Robert sir, please unmute yourself. We are not able to hear you.
I'm sorry. Dr. Padmini, many of your friends, colleagues, and students, they are also part of it. They are joined now.
Oh, thank you. That's lovely to know.
So if you remember Praveen, who introduced me to you, in one of the programs.
Yes.
Yeah. So I just told about it. He has joined. He's there in the program.
Oh, that's so nice.
Professor
to know.
Nine
Yeah, he was
also
my
is there.
MSW student. Yeah.
Sir, I joined him also as a panelist, so that let him talk to madam.
Okay.
Oh, that's fantastic.
Praveen sir. Dr. Praveen.
So I'll just check with him whether he has joined right now.
Yes, sir. I have made him as a panelist.
Yeah. Praveen, you can unmute and speak to your teacher. We have a little more time.
Yeah, good morning, madam. Good morning, Dr. Pradeep, ma'am.
Hi, Praveen. I need to see you as well.
Yeah, show your face, Praveen.
Remove mask now. I'm in office anyway.
Yeah. How are you, Praveen?
I'm really good. I'm so excited to see you today.
Oh, thank you. Thank you. You're the one who made the first connection with Robert and myself.
Yes, ma'am. I still remember.
Yes. Nice to see familiar faces.
He's doing well, Dr. Padmini. He's a manager in one of the MNCs in Bangalore.
Oh, fantastic. I had no doubt about that at all.
Yeah. Thank you, ma'am. Thank you.
And the other person you see is Mrs. Sureka. She is the president of our Alumni Association chapter in Bangalore. So we have a chapter in Bangalore. So they are very active. They have been helping us a lot.
Fantastic.
So she's heading, and she's also the director of student services in a premier B school in Bangalore.
Oh, fantastic.
Great
so
meeting
happy
you,
to see everyone so successful.
Yes. Thank you so much, ma'am. Great interacting with you here.
Same here.
So it's evening for us, no? I think at what time is it now?
Now it's going to be 4:30 for us in another 5 minutes.
Okay. You both are in two different places, or are you in the same?
No, two different places. Andrea's in her home, so we just thought we'd be COVID safe, though we are quite mobile here.
Okay.
And I thought just more from the echoing and stuff. So we're about 20 minutes drive.
Oh, that's it. Okay.
Robert sir, shall we start the program, sir?
Maybe another
5 minutes, sir.
not 5 minutes. It's now 56. Maybe another 3 minutes. We'll wait. Yeah. Yes, Dr.
Okay, sir. Okay, sir. Okay.
So, Dr. Padmini, they have been, organizing hundreds of webinars. This university. So they are very professional about the logistics, the timings. So it's very nice to collaborate, and we got an opportunity to do that.
Yes, it's a very good, very good opportunity. And when people are really, punctual on time and they've done the pre-work, it's easy.
Very pleased to meet you, ma'am, today.
Same here, same here.
Dr. Premlada, you can just share. She's in Bharatiyar University, Dr. Padmini. So the organizing secretary, she's in another program for some time. She'll join us in another 15-20 minutes. Dr.
Excellent. Hello, Premlata. Nice to meet you.
Hello, ma'am. Vanakkam. நல்லா இருக்கோம்.
தமிழ்லயே பேசுறேன் இன்னைக்கு நானு.
Right, ma'am.
Even Dr. Premlada, இவங்க ஸ்டெல்லா மேரிஸ்ல படிச்சவங்க.
Super, ma'am. Super, sir. Super.
So she has Tamil Nadu connection too.
Oh, right.
Yes.
Which country, sir?
No, but my Tamil is not good. That's all I can talk.
Ma'am, no problem. But many of our participants only from the other states, not from Tamil Nadu.
Yeah. Mine is very cherry Tamil, so I can only do spoken Tamil, not more than that.
But it is very nice to hear, no?
Yes. I'm just going to run and get some tissue paper. My eyes are watering a bit watching the screen. Just excuse me for 1 minute.
Yeah.
No problem.
You're all set, Andrea?
I sure am. Thank you.
I'm just avoiding the headset. I hope what we talk is clear.
Yeah. It's clear, very clear. It's very clear.
Yeah.
Robert sir, I have added Ribu madam.
Yes, done. Thank you. Yes.
Any other person, sir?
Right now, I think only that much.
This much. Okay.
So. We can start.
Yes, sir. Yes.
Dr. Premlada, yeah. Samuel, sir, we can start.
Yes.
Please. Yeah. Dr. Padmini, we'll start?
Yes.
Okay. Good morning, everybody. Let me welcome all of you to the third day of the international webinar on Every Child Matters, Reaching the Unreached, Strategies, Challenges, and Success Stories. It's jointly organized by the Center for Capacity Building Programs for School Teachers, Tamil Nadu Teachers Education University, Chennai, and Crossland College, Brahmavar, Udupi, Karnataka. We're extremely happy to have another fruitful session today. We are really excited to really listen to a very eminent speaker. I just like to say a word about her, then I just leave it to Mrs. Surekha for the introduction and welcome. I met Dr. Padmini way back in 2004 through Mr. Praveen. He's also present here. And ever since I've been following her, she was the one who introduced me to the life skills. Just like a small child, I attended her first session. I still remember, with a charming smile and the caring, words, she can put anybody at a comfort level. And I just want to really thank Dr. Padmini for accepting, because this week has been one of the busiest week for her. I couldn't even reach out to her for 2 days. She was out of the coverage area, but she came back, and we could really get her on board. I just like to put things in context today for the theme. I'll take maybe about 30 seconds. Two people were walking. Suddenly, the person who was walking behind, he just came front, and he just hit the person on his cheek. The person who was attacked got so wild, and he turned back to hit the person, back. The other person said, wait, wait, wait. I know you are angry, but I just hit you. Please tell me there was a sound, right? And the person said, yes. Was the sound from my hand or was it from your cheek? And the man said, I'm sorry, I don't have the time to theorize, but one thing I know, it is paining. And for sure, I know Dr. Padmini Pai can really understand and feel the pain of others. Not just that she teaches life skills, she practices with a lot of empathy. Every student who has gone through her will say that. I have seen, including students from abroad who comes to her to India, many times I've seen, they really feel grateful for the way she really touches their hearts. Anybody who feels low, she will really bring up their spirit and really transform their life. That's Dr. Padmini Pai for you. And today she's going to really share something about that kind of an experience dealing with mental health, of professionals during this particular time in Australia. And we are looking forward to that. And I'm extremely happy today we are joined by one of the very prominent alumni of Crossland College, Mrs. Sureka Shetty. She is the Director of Student Services, IFIM, a very premier business school in Bangalore. And she's a very busy person. When I just requested, can you just join us for an introduction? She happily agreed. And last night we had even a kind of a rehearsal. She's so humble and, she's courteous to join us. So Mrs. Sureka, I request you now to introduce and welcome everyone on board, please.
Thank you very much, Robert, sir. It's always a pleasure to come back. Very good morning to one and all. On behalf of Tamil Nadu Teachers Education University, Chennai and Crossland College, Brahmavara, we welcome you all to the third day of 1 week international webinar on Every Child Matters, Reaching the Unreached, Strategies, Challenges, and Success Stories. I would like to welcome the Honorable Vice Chancellor of Tamil Nadu Teachers Education University, Chennai, Professor Panchanatham, respected Registrar, Professor Balakrishnan, Dean of Faculty, Professor M. Govindan, Principal of Crossland College, Professor Samuel K. Samuel, and the Organizing Secretary, Dr. Shivashakti Rajamal, and all the participants who have joined us today from across the globe. Today, the third day of 1 week international webinar, and the theme is A Caregiver's Experience of Reaching the Unreached in the Australian Bushfire Experience and the SEED program. Let me welcome and introduce today's eminent speakers to you all, Dr. Padmini Pai and Ms. Andrea. Dr. Padmini Pai lives in New South Wales, Australia for a long time now. She's been in the healthcare setting and she's mostly engaged in designing and implementing wellness initiatives and emotional support programs. Presently, she is the PRMS Manager, Clinical Governance Unit, and Program Lead, Be the Change Initiatives, and Program Lead, SEED Wellness Initiatives. This position was created at the CE's request during the bushfire crisis. She was tasked with the responsibility to help the Director of Nursing to support staff of Milton Hospital during a period of uncertainty, personal loss, and community crisis. She was also instrumental in designing and delivering a staff-led initiative to provide high-level emotional support to 100 staff. She won the Staff Excellence Award in May 2010, nominated by the Director of Nursing, Bulli District Hospital, Australia. Before moving to Australia, Dr. Padmini held the responsibilities as Principal, Dean of Sri Devi Institute of Social Work, Mangalore, India. She's conducted several workshops on positive mental health for corporate and non-corporate sectors. She's worked as school counselor. She is a life member of NIPM, National Institute of Personal Management, India. She's presented several presentations in international conferences. She's been a visiting faculty to Heart Health and Home Care Services, Malaysia. She's a life member of Richmond Fellowship Society, India branch, member of IWIN, Illawarra's Women's Interfaith Network, Wollongong, member of the Rotary Cultural and Vocational Group Study Exchange, team visiting Pennsylvania, USA, coordinator, Mental Health Professional Network from 2015 till date. She's also credited as a master facilitator of the Virtues Project. She's been a member of the Australian Association of Social Workers since 2007. She conducts workshops on life skills and virtues project to teachers, students, and other professionals. She's conducted several workshops for various local Rotary clubs on the flagship program on RILA. She has strong academic credentials to her credit. She completed her PhD in social work from Mangalore University, Master of Philosophy in Psychiatric Social Work from the reputed Mental Health Institute, NIMHANS, and she secured second rank in her MPhil at NIMHANS. She completed her Master of Social Work from Madras University. We welcome you to this webinar, ma'am. Thank you very much for gracing this event today. Thank you. Let me welcome the second speaker, Ms. Andrea Nezovic. She is the fourth year social work honors student at the University of Wollongong, Australia. She's been a student of Dr. Padmini for the past 2 years in 2 major projects. She's been volunteering for the past 10 months during and after the 2019-20 Australian bushfires, working with healthcare professionals to create a sustainable wellness program. She's currently doing her research on the Wellness Warriors, a bushfire recovery initiative that was put in place at a 25-bed hospital in Milton, NSW, Australia, where approximately 100 staff were affected by the bushfires since they all came from the local area. She's also passionate about the strength-based ways of working, and well-being is her newly discovered passion, along with research and supporting younger professionals in the field. She has provided peer support to many of her colleagues who wish to volunteer in this area, and is also seriously exploring doing her PhD in the same area once she completes her current degree. Let us welcome Dr. Padmini Pai and Dr. Andrea to make their presentations here. Thank you. Thank you for joining us today.
So
Thank you.
Thank you, Mrs. Sureka, for such a wonderful introduction and welcome. I would like to thank you for joining us today in spite of your busy schedule. It's really a privilege and honor for us, an alumni who really is able to join us. And I also want to welcome Dr. Premlada, who will be the host today for some time in the absence of Dr. Sivashakti. Dr. Premlada, thank you so much. Dr. Padmini, now over to you.
Thank you very much. I'm just going to take a second to share my screen and then start the presentation. Can I check that you can see the screen?
Yes, it's clear. Your voice is also clear.
Okay, excellent, excellent. So thank you to all the organizers for this opportunity to speak today. And on behalf of Andrea and myself, it's a really humbling experience to accept this invitation. On the screen, I can see around 268 participants. So my heart reaches out with warm greetings to all of you. It's also lovely to know that many people who are listening to this presentation in your own right have done a lot of work in this area, and together for the next 1 hour, what Andrea and myself are going to do is share our experiences in a totally different context of reaching the unreached, and really looking forward to a discussion on how lessons learned in a field of giving is always transferable when we've done things, one, from our heart, And second, when we've had a strong academic and research component that informs our evidence-based practice. So today, what we are planning to do, I'm just trying to go to the next slide. Our objectives today are 4. One is, how far do we need to go to reach the unreached? The second theme is, you are the first link. So anything that we do in this area, not to lose sight of each of us as caregivers, whether we are in the role of a teacher, a supervisor, or coordinating anything that we do in this space, we are the first link. Then we'd like to move on to what the SEED program is all about. So we'd like to share what we've done in our context here and the framework. And lastly, we would like to give a caregiver's experience to reach the unreached, Andrea and my personal stories. And we would really appreciate if you can have lots of questions. Maybe what we will plan is at the end of our presentation, we'll take questions, because sometimes even if we have a burning question, it may be answered during the course of the presentation. So first, when we're talking about how far do we need to go to reach the unreached, when the magnitude of a problem or a difficulty is in front of us that is as big as a natural disaster or as big as an event in a person's life, or maybe as big as a child losing their favorite eraser in the class. Every incident is big or small in the perspective of the person. So therefore, when we're talking about the role of a teacher reaching out in this context of reaching the unreached, it is about each of us influencing one child at a given point in time. It's really important for us to chunk down what we do when we are in this situation of reaching the unreached. It is also about meeting the child's needs. So whether it's in the classroom, whether it's in the playground, whether it's in the school, with the policies that we are part of developing, to really take our focus to what is the need of the person and what is the need of the person at the present time. What is the child, what is the adult, whoever is in front of us, what are they presenting? And really to narrow it down to the here and now. It's also about balancing our academic roles, our responsibilities, our deadlines, and all the expectations that we undergo at one and the same time. So as much as there's a need in front of us, for us to also not lose sight that there's a myriad things happening around us in the midst of what we are doing. And that's my favorite quote from Dr. APJ Abdul Kalam, that sometimes the best brains in the nation may be found in the last benches of a classroom. So many a time when we're talking about the needs of children, we may have a group of children in front of us, or we may have situations in front of us that take our attention because there is a bit of disruption. But actually, to kind of change our mindset is very, very important, just to lay the foundation. So for us to really define what we actually mean by reaching the unreached and how far we are going in this situation. Next, let's take our focus to you are the first link. So each and every one of us. So now I'm talking to you. We've got a bunch of people listening. Let's just take the focus back on ourselves. Many a time we can get drowned by the expectations and by the magnanimity of tasks that are in front of us. But really, the first link is you. So what is your core strength as a teacher? What is my core strength in this situation? How do I feel today? Not to lose sight of our day-to-day well-being as well. And does our situation here and does practicing our strength make us stronger? So in every presentation that I do, I always am conscious to really not lose sight of who are the people in front of me and who am I in the mix of what we are doing. So literally, if we can focus on what we mean by us being the first link, we are here talking about what our core strengths are. And when we're talking about strength-based ways of working, it's not just a feel-good situation that we are talking, but there is a lot of science behind why it's important for us to work in our strength-based ways of working. Because today we come to know that in every situation, even if we have to see 10 years back or 20 years back, in every situation today, the complexity is so much that we tend to really give from sometimes a space of an empty cup. So when we're talking about a strength-based ways of working, what we're trying to do now for the next few slides is to really take our attention to the science behind strength. Because when we come from a space of our strength, when we come from a space of our confidence, research has shown that people who are operating in this area, than from being burnt out or than from being tired, people who operate from their strength space are generally much more happier, more confident, have good self-esteem, perform better at work, have less stress compared to their peers, are more resilient, are more likely to achieve goals, are more effective in developing other staff members, and also have a level of energy and vitality that's palpable, that can influence people around. So that's why the second focus that we have is you are the first link. So when we're talking about our strengths, we also have to realize that discovering our strength is a very personal journey. So what is my strength at this given point in time may be very different from what my strengths are at another point in time. And how we see our own strength is very important, because sometimes other people can see a strength in us that we do not see in ourselves. So it's very, very important for us to have focus on what we see and what we're proud of in ourselves, and then operate from that space. We'll go into a few practical exercises very soon. So when we're talking about our own strength, one thing for us to remember is our strength can change from time to time. And I think thanks to COVID-19, we all have adapted to what change is in a very different frame of mind. And some of us would have been early adopters to change. Some of us would have had forced situations where we have to change. But every single one of us here, when we're talking about working from a strength-based point of view, maybe new strengths of us is emerging that we really didn't know as well. So how do I know whether something is my strength or not? So the three magic words, if I may say, in the strength-based ways of working is for us to see, does my strength affect my performance? Does it give me energy? And am I using it? So simple. For example, as a teacher, if patience is your strength, we can't say that patience is my strength, but in the classroom, I'm very fidgety, or patience is my strength, but in the classroom, I get irritated very easily. Then we got to really revisit that strength if it is not coming up in our performance. Same with the students as well. So if we're talking about a student's strength as being obedient, as being caring, or as being hardworking, is it really showing in your performance? Does it give us energy? Anything that makes us stronger has to give us energy. Because if our strength is not giving us energy, but at the end of it, we're feeling overstressed, overcommitted, that means we are really not using our strength to the optimum. And sometimes when it does not give us energy, we also have to see which is another strength that I have to throw in the mix to keep my strength. Because many a time, say for example, and if I can go back to my days of teaching, if there was a very responsible student that you identify, you tend to give more and more responsibilities to that one person. Yeah. And where we gauge how much responsibility we can give somebody is whether it's giving them the energy or no. So say, for example, if caring is your strength in a family context and all the time you are the caregiver and sometimes you're getting tired, then that's an indicator that my strength is slowly turning into my weakness. So not just in our performance, how much energy it's giving us, and how often do we use our strength? Okay, how often do we use it? Because if we are using our strength, it's our core strength, but it's only very rarely that we use it, then maybe that's another indicator whether that's a strength that I'm bringing to my day-to-day work or no. So whether my strength is reflected in my performance, energy, and how often I use it. So examples of some of our strengths can be compassion, openness, trustworthiness, reliability, patience, independence, just a few strengths here to be listed. And when we talk about strength-based ways of working, it's also in our role as teachers, we spot strengths in others. So when we're talking about spotting strengths in others, it's about realizing our own strength and also looking for strengths in other people. And that's a really good way in which we can connect to each other as well. Once we fine tune our eyes and our mind and our heart, it's very easy to spot strengths in others. But again, here, we got to realize that when we're working from the strength-based ways of working, it can make few people uncomfortable as well. That's why we have to really get our concepts and practice right in a strength-based ways of working. So when we talk about spotting strength in others, for example, sometimes the way we use language is very, very important. So an example here is, I notice how quickly you connected with a new classmate. That really helped her settle down today. Well done. So you're really giving a context to the child here when you're polishing a strength of connectedness, instead of just saying, well done. So these are very small but very potent ways of communication where we can polish strengths in us. Can do in this area is value audit. We have used this value audit quite often because sometimes when we talk about strength-based ways of working, it can appear as though we're doing a feel-good exercise. Yes, it's a feel-good exercise, but it is also much embedded in practice as well. And when we do a values audit, what we can do is actually take some time and do a bit of reflective practice on what our personal values are and what our work values are. And a very good time to do this is when we are at crossroads. Because many a times when we use our strengths and everything goes on smoothly, we just move on from one task to the other. Except that if we really put reflective practice as part of our knowledge base or part of our ways of working, many a time we just run from one task to the other. But sometimes where we really have to say, stop, I think I have to go back to my strengths. A very good situation where we can do it is actually when we are at crossroads or when we faced a difficulty. It may be press a button in us and we may wonder what the hell is happening here. Maybe I have to go back and do my own values audit. At this stage, I would like to request Andrea to give a real-time example just to clarify this concept, and then we'll carry on from here. Over to you, Andrea.
Thank you, Padmini. Good morning, all. So the values audit is a tool that I learned in my first social work placement at a hospital. My supervisor at the time explained to me that we carry with us both personal and professional values, just like Padmini explained, which sometimes overlap and can be challenging for us. My example I will share with you is from a student space when completing my final social work placement. At this time, I had already completed my first placement in a hospital, volunteered in the health district for 2 years, and was currently in the process of completing my final placement in health yet again. It was about halfway through this placement that a couple of other students started their placement with me. When working with one student in particular, I could not help but notice that my buttons were being pressed when she would interrupt people of authority and communicate with little respect in a professional environment. At the beginning, I couldn't understand why the way this student was talking to people of authority had pressed my buttons, so I decided to do a values audit. Upon doing this, everything began to make sense. My buttons were pressed because my core value, which underpins my personal and professional self, is respect. And it was very evident that I did not feel that this student had any respect for people with authority, that students. But it was up to me to identify what my personal and professional values were to move forward with my placement. I am now able to recognize that respect is in fact my value and my strength, which underpins my personal and professional self.
Thank you very much, Andrea. I really like that example, and every time I hear it, it speaks very differently to me. And I think what you have explained really clearly and honestly is how you have not let your strength become your weakness. Because sometimes when we over-exercise a particular strength, instead of it being a little stepping stone, it can become a stumbling block. So it's really important for us to know what our strengths are, do a little bit of reflection around it, and move forward from there. Thank you, Andrea. So when we're talking about us being the first link here, it's also about giving from a full space. So sometimes when we are tired, when we are feeling emotionally exhausted in this giving space, and especially when we're talking about reaching the unreached, and I love your theme about reaching the unreached in a child's context, it's really important for us to give from a full space from time to time. And also for us to really have a backup plan to see what are the sources that refill us. How do we fill our own cups? It may be small breaks, or it may be reading, it may be reflection, it may be spirituality, it may be walking on the beach, it may be just about anything. From time to time, we as caregivers, how are we going to reach the unreached? Taking care of ourselves is very, very important. Let's now move on to our third concept of what the SEED program is. So we've kind of spoken about reaching the unreached. We've touched upon we as being our first link. And now for the next 10 minutes, we're going to share with you our own experience. For the 10-15 minutes, we're going to share with you our own experience about the SEED program. I will start off giving you a very broad perspective of the SEED program, and then again request Andrea to give us a little bit of insight into up to where she is right now currently with her honors studies in the same field. So like the organizer introduced and mentioned about the SEED program, I'm sure pre-COVID, the whole eyes of the world was in Australia when we were burning for more than about little more than 1 month. And where Andrea and me come from, we were about 2 hours away from the fire. So it was our reality. And even the area where we come from had that much of bad smoke and a lot of secondary stress and tension. And it was one of the worst bushfires that we faced in Australia. And it was at that time when things were slowly settling down that my CE, I work for a 8,000 employee base NSW Health. And my CE had chosen me and requested me to go to help the staff in a small hospital that was very, very close to burning down to the ground. So packed my bag, 2.5 hours of driving when the fires had settled, of course, and we all were safe, to go and help staff there. 8 staff had lost their homes completely. burnt to the ground, and every single person in the hospital was affected. And using a participatory action methodology, not having value judgments, going with an open mind and heart to just sit with staff. And these were all high functioning staff who were saving lives in the emergency department and going through what they have gone through. The SEED program was born. And as we know, we're just calling SEED as an acronym. So we did a lot of focus groups, a lot of discussions, and this was a program that was born from the staff, by the staff, for the staff. And SEED was an acronym for what we all wanted at that point in time. All of us wanted a bit of stability. We wanted to encompass each other, take care of each other. We wanted endurance to go through this fire situation, and also a sense of direction. The reason we are sharing the SEED program with you is because as you're listening to us, when you're in the space of reaching the unreached population in whichever shape and form, I'm sure you can see a lot of parallels, because when we're talking about the giving, being in the giving space, the situation may be different. But somehow, as you listen to our presentation, what I would like all of you to do is draw parallels in where you are currently and see, yeah, this is something from the SEED program, maybe that I want more information and we can be in touch from there or share much more resources with you. So just sit back, relax, and as we go through this presentation. And at this stage, how we have planned this presentation for you is to have a strong scientific base, because sometimes in the giving space, it may look like we're pumping out things really quickly. So say, for example, even this webinar, it would have come together so quick in the pandemic space, but that does not discount the amount of backstage work that has happened. So in the same way, the SEED program is now running for about 6 to 7 months. Ministry of Health is watching us closely for lessons learned. We're getting a lot of funding to see how come when something takes so long in normal time, we have achieved so much in a short period of time. And generally in a bureaucratic setup, permissions can take 6 months, and here our program is up and running, and now other hospitals want to know the lessons learned. So there's a bit of backstage work that has happened, and really small is all. And few initiatives that we put together very, very quickly. Day 2, day 3 was setting up a quiet room so people can go have a break. We set up coffee buddies, so each one can take care of one person. Go to a cafe, have a coffee. It's a free coffee for you. You know, just keep an eye on one person. Don't have to stress about everybody. We had Wellness Wednesday sessions. So every Wednesday we had paid time to go and do meditation or sit in a group and share our common grief. And we had this flagship program called Wellness Warriors, where we had a mixed group of staff, from the cleaner to the doctor, to the allied health, to the nurse, a real group of people coming together. And we quickly had a 2-day program where we learned skills of the art of companioning. So part of the Virtues Project, Life Skills Project, is easy listening skills that we can learn to really support each other, because many a time when crisis happens, we don't have to have a huge diagnosis. It's just about listening to understand, not listening to fix. And that's the Wellness Warrior program. Andrea will be talking a little more about that. And we felt that 2019 did not end for us because we worked through the fires. So we had a little closure and had a New Year party. So all this together was our SEED program. And now what we are going to do for the next 6 to 7 minutes is I'm requesting Andrea to do her little presentation. I shouldn't be saying little, Andrea, it's a big presentation. And the publications that's going to come in this field when we really concentrate and do good work and have research supporting us. Over to Andrea.
Thank you, Padmini. Okay, so let me begin with a quick recap of the 2019-2020 Currawong fire and how it was the catalyst for the creation of a sustainable wellness program for healthcare professionals at Milton Ulladulla Hospital called the Wellness Warriors. For the last 9 to 12 months, the waves of global disasters and global pandemics have caused unimaginable adversity and trauma across communities. My current research is looking into this significant impact on healthcare professionals who are both experiencing personal loss, grief, and stress and working to support the safety of others in a time of crisis. While knowledge of the effect of re-traumatisation of staff in healthcare is well known, there is little evidence that having an innovative model of strength-based ways of working in a disaster environment is effective. In this compelling photo, we see Michelle, who is the pharmacist at Milton Hospital, in front of her home that was burnt to the ground, and still turned up to work to provide excellent care for her patients. I am honoured to have volunteered my time to work with Padmini, the program lead, who is also my second supervisor, and together with the staff at Milton Ulladulla Hospital, we designed a holistic wellness program in the aftershock of the fires called the Wellness Warriors. 18 staff attended a 2-day Wellness Warrior training in strength-based ways of working, mindfulness, and active listening. This project will focus on the Wellness Warriors, both what it involved and the Wellness Warriors' perspectives of following the bushfires and during COVID-19. There is a gap in literature addressing the wellness of healthcare professionals following a disaster, and therefore understanding the impact of the wellness warriors from the perspective of the wellness warriors themselves will assist in providing a framework for supporting healthcare professionals during a time of crisis. The research question for this study is, what are healthcare professionals' experiences of the Wellness Warrior program run to support their wellbeing post-bushfire and during COVID-19? With the aim of the study being to understand the experiences of healthcare professionals who have engaged in the Wellness Warrior program at Milton Ulladulla Hospital. This study uses an exploratory descriptive methodology, which is frequently used in studies that investigate phenomena where previous existing research isn't available. As far as we are aware, there is no research on the success of particular programs to support the well-being of healthcare professionals immediately after and during disasters. Participants were recruited for this study based on their employment being at Milton Ulladulla Hospital and if they participated in the 2-day Wellness Warrior training. During regular meetings with the program lead, Wellness Warriors were informed of the study and informed it was voluntary. A purposeful sampling approach was then used to identify and select participants who were experienced healthcare professionals with a breadth of understanding. The exact sample size was dependent on the willingness of the Wellness Warriors to participate in the study. However, as this is a small qualitative study, 8 out of the 18 Wellness Warriors were then selected to participate. In the meantime, thanks to Louisa Smith, my primary supervisor, ethics approval was granted through Regis, and all 18 participants were interviewed for further publications, ensuring I had a sample size of 100% to make robust conclusions. My study uses a qualitative research design. Hence, I'm measuring the research objectives stated below. The research objectives are to use semi-structured interviews with wellness warriors to understand what was effective about the training, skills, and ongoing support for the wellness warriors, to understand the challenges and opportunities for the Wellness Warrior program, to understand the immediate usefulness of the Wellness Warrior skills in a bushfire context, to explore the ongoing usefulness of the Wellness Warrior skills in the face of a global pandemic, and to disseminate the findings in an academic journal. The instruments in this study were short 30 to 45 minute semi-structured phone interviews with 4 questions at the beginning establishing participant demographics and 10 clear questions addressing the aims of the study. Interviews were conducted over a 6 to 8 week period with participants sitting in a private room in Milton Hospital during their shift. With consent, interviews were audio recorded, transcribed, and de-identified. The software package NVivo will also be used to facilitate qualitative analysis. Transcripts will be analysed using an iterative constant comparative approach to ensure independent coding by at least 2 researchers and agreement reached by team consensus. In accordance with an exploratory descriptive methodology, a low inference approach will be used for data analysis of interview transcripts. This will mean that the original meaning of the data will be retained, and I will not be applying conceptual or theoretical frameworks to guide analysis. An emergent approach to coding and theming development will also be used. My next step is data analysis, followed by discussion, conclusion, and recommendations. Based on my initial reflections on transcripts, field notes, and discussions, my supervisors and I have discovered the emergent themes: 1, courage and bravery; 2, collective resilience; and 3, change in growth mindset. Although there is limited evidence-based literature published on a global scale on supporting healthcare professionals during and post-disaster, Walsh and Yuma et al. Articulate that communities affected by disasters have highlighted the importance of post-disaster intervention to foster resilience. The emergent theme of collective resilience of the wellness warriors in the recovery of the bushfires supports this literature. Rance, Lenson and Amers suggested that future research should be conducted with healthcare professionals post-disaster to enhance future disaster preparedness in health. The emergent theme of change in growth mindset extends this literature through the wellness warriors' innovative strength-based ways of working. Yuma et al. State to support healthcare professionals in building individual and collective coping skills, interventions must draw on psychoeducation, group work, and mindfulness. The emergent theme of courage and bravery supports this as wellness warriors stepped outside of working from a medical model. An example of how the 3 emergent themes of this study both support and extend current literature is during COVID-19. The pandemic provided a real-life test for wellness warriors, as Milton Aladullah was in the midst of recovering from the bushfires when COVID came their way. It is during this unprecedented time that the courage and bravery, collective resilience, and change in growth mindset of the wellness warriors was brought to light, as they were prepared and equipped to use their new coping skills from the training to support their patients, colleagues, and even leaders. I am eagerly awaiting what my conclusions and recommendations will be for this study, soon after my results are analysed. At this very early stage, the 3 emerging themes have been recommended in various presentations done by the program lead to the Academy of Clinical Innovation and New South Wales Ministry of Health. To end on a happy note, the Illawarra Shoalhaven Local Health District has nominated the SEED program, which the Wellness Warriors is a part of, for the 2020 NSW Premier Awards under the category of Recovery and Resilience. Stay tuned and thank you for listening. Over to Padmini.
Thank you, Andrea. That was a fantastic presentation. So very, very quickly, Andrea has really gone deeply into one of our initiatives. And that again is to share with our listeners and viewers today that every single thing that we do in this space, when we come together collectively, and if there's any interventions that we have done, it may be a case study, or it may be something that we do well in a particular school, or I love the way this whole program has come together, where 2 states have coordinated. Really to throw some research around it and share our information is very, very important as well. Because we realize for some of us who are doers, we do a lot of things, but we really don't spend time to sit and quantify. And I think with 319 of us listening to this presentation at the moment, or maybe much more on YouTube as well, how can we come together as a small group and really do little work in our own area that can have high impact and have a research component attached to it as well. So Andrea has very nicely summed up what we have done at our top-down, bottom-up approach, very non-hierarchical way of working and creating emotional safety for our own colleagues. We've seen this picture of Michelle. I put in this picture, and I just want you to take your attention to this small helicopter. This was taken by the head of the hospital from his terrace. So this was his reality, and that's his son that we can see. So Stuart is the head of the Milton Aladala Hospital, and smoke everywhere, everything burning, days and days and days. They were trying to save each other's homes, and that little helicopter that you can see was what brought hope to that community. And that was the magnitude of what we underwent in this part of the globe. Of course, along came COVID, like Andrea spoke about, and there was a two-speed reality. But for the Milton staff, wellness was already in place. So among our 8 hospitals, the way this hospital coped was very, very different with COVID than other hospitals. Of course, here we've just got a few names written down just to show that when we do anything in reaching the unreached space, it is about collective leadership. So Margot Mains is our head of the hospital, and she's the one who sowed the seed, and the rest of us did our little bit. And then we saw staff flourishing in that area. These are 2 beautiful quotes, because anytime when we receive, we always want to give. So among everything that was happening, the staff wish was that what lessons we've learned from our hospitals have to go everywhere. So for the teachers who are listening today, remember, when you do one small thing for a child, whatever big or small it is, each of us now can really reflect, I can fast forward. So when we're reaching the unreached, for us to see, it may be a small action that we are doing, but when it comes from a full space, the measurement of the after effect of it is going to be exponential. This is my favorite quote from Mahatma Gandhi: the future depends on what we do in the present. And for us not to lose sight of the present when we are in this atmosphere, or when we are in this stressful situation sometimes of giving as well. So just another few more photographs to show how our program now has moved from Milton to other hospitals. So it's moved to another 4 major hospitals in our district. These are few photographs where totally different reason. It started off with fire being the catalyst, but in every hospital, there were different catalysts. So these are some of the photos that we wanted to share with you. The person in the red suit is one of my colleagues, John Andrews, who underwent elective bypass surgery and passed away. He was one of our wellness warriors, totally unexpected. And the whole hospital was grieving his loss. And that's where the SEED program and the principles of SEED program helped everyone collectively to come together. This was where the old hospital moved into the new space. We were not supposed to have any parties, but we had a social distance party to say bye to the old hospital because it moved to a new hospital. So SEED is not just about sorrow and grief, but also rejoicing small wins as we go. We've had a lot of inter-hospital collaboration, road trips, because we are spread over a big geographical location, and we've had staff going from one hospital to the other, helping each other in need as well. We've done a lot of group work for the nurses, and also taken the lessons that we have learned in the wellness space back to our patient group. And this is a aged care hospital, and they have really taken seriously the skills that they have learned and how they can help to reduce falls in the hospital setup. So a lot of theming, a lot of work around having those conversations and really going into small is all and reaching the unreached in our given space. So lastly, to conclude, we've just got 2 more slides to go. We would like to share our own lessons learned in this space. And here we're talking about 2 important quotes here. And I'm sure all of us have seen these quotes. One is about doing the same thing over and over again and expecting different results. So maybe in the pandemic space, it's really given us an opportunity to say, what are we going to do differently? We're really good in what we're doing, but what are the other good things that can come up is very important for us, thanks to Einstein. And also the importance of changing our mindset. I'm just going to move this a little bit so I can read it out to you. One cannot alter a condition with the same mindset that created it in the first place. So if we are going to really create something new, then we definitely have to bring about a new mindset. So what were our lessons learned in this situation? And when we're talking about reaching the unreached, how can we simplify what's in front of us? Yes, all of us here have collective wisdom. We've got a lot of tacit knowledge and explicit knowledge. So the explicit knowledge is from the books, libraries, all the degrees that we have. And the tacit knowledge is day to day, what's that information we have? We know at our gut level, this will work, that will not work. That's our tacit knowledge. And then we have evidence base around it. So as a starting point, we go into our gut feeling. So the main lessons learned for me was always to listen, to understand, and not listen to fix. Because many times we all are fixers. As moms, we are fixers. As dads, we are fixers. As teachers, we are fixers. So really, the big lesson for me was just listen to understand. What is that person trying to say? I don't have to fix, because sometimes I can't even fix. Your whole house is burnt to the ground. How am I going to fix it? But I can listen and understand what you are feeling. And I can be that person for you. Maybe I can make a cup of coffee at the end of it for you. And beautiful Michelle, whose photo that we showed, because we used a post-traumatic growth model, not a defect model. So you will remember, Andrea, when Michelle was the first one who came and said, I want to do the wellness sessions every Wednesday because that's part of my healing as well. So really, we listened to Michelle's need. Her need was to give so that she could cope with her loss. The second big lesson for me in reaching the unreached was don't strive for perfection. And many a time for us who've got a reputation in the organization, we put a lot of pressure on ourselves and we feel quite exposed because everything that we do is either on the media or we wrote a report that goes to 8,000 staff. So we put a lot of effort on ourselves and that can lead to inertia. So what are our low-hanging fruits? What can we do straight away? You know, what's within my reach to do, and then develop those small pockets of confidence and not to strive for perfection. It's okay if certain things don't go away, stop, course correct, carry on. So when we've invested so much into something, then when it doesn't go the way we want, then we get very upset. So really in this space, when we're reaching the unreached, not to strive for perfection, to strive for sincerity, do things sincerely. 99% things will go right. 1%, if it doesn't, people know that the effort has been put, move on. And the biggest lesson for me, the third biggest lesson for me among the 100 I have in the notes, I used to write every day, 3 notebooks full so I don't forget anything, is small is all. What is that one small thing that I can do today? Because that small thing is going to be like the seed that's going to sprout and then provide shade for a big and turn into a big tree. So small is all is one big lesson. What is Andrea's lessons in this whole process? Because she had volunteered in the seed space and worked really alongside me. So over to you for you to share your lessons, Andrea.
Thank you. So one of my main lessons volunteering during the bushfires was trusting in the process. And that has been an exponential learning for myself over the last 10 months. So going into the bushfires, I saw myself as only a student. I didn't believe that I sat as equals with the leaders around me, and that tended to weigh me down. However, putting myself in an uncomfortable situation where I didn't have to have the answers to everything, trusting in Padmini as my supervisor has brought me to a point of learning that I will remember for the rest of my life. I have grown not only as a student, but as a young woman and as a daughter and as a social worker. So by trusting that everything will fall into place the way that it's meant to be, I have reached the unreachable. My second learning has been it is okay to dream big. My parents have always taught me that it's okay to dream big, but how big is big? So going into the bushfires, I didn't have many expectations, but to help those in need. I started my honours thesis working with people with dementia, which was a passion of mine, but not as big as a passion of working with people in crisis and disasters. I asked the university to do my honours in something different, but they didn't let me at the start. There was no honours available besides what they had handed me. So I trusted that in time, one day I'd be able to research something I was really, truly passionate about, and that lied with disasters and crises. And I dreamt and dreamt over my 5 months that I spent in Milton Hospital during the bushfires, and my dream came true. I was offered the opportunity by the university to research my experience in the bushfires and working with healthcare professionals in a time of crisis. So that experience has taught me that it's okay to dream big. It's okay to dream big, and I've been able to put that out to all my students and peers that we will get to where we want to be if we dream. And the third lesson that I've learned is drawing on my roots. And for me, it's my family. So my family came to Australia as refugees in 1995 from former Yugoslavia. They left their whole family behind to provide a better life for me and my sister. It is this past family experience that has led me and determined me to get to this place where I am today. So drawing on my family roots, when I was driving down to Milton during the fires, I looked on the left-hand side of the road and I saw a pink house with broken windows that was devastatingly impacted by the fires. When driving down, I left my family behind, and when I saw that house, I was reminded of our home in former Yugoslavia that was full of bombs and the windows were broken and there was holes in the ground. But just seeing that home made me feel like I was on the right path. I was able to sense that I was here for a reason, and I was determined to do what my family didn't have the chance to do overseas, to help those in need. So being able to draw on my strengths, my determination, my respect is what got me to where I am today. Thank you, Padmini.
Thank you so much, Andrea. That was a very, very beautiful way to summarize what the SEED program meant to you. So to conclude, we would like to say a big thank you to everyone who is listening, to the organizers for giving us this opportunity, and also for us to know that leadership is not about positions and titles and flowcharts. True leadership is about one life influencing the other. Thank you once more, and we are open for questions, and it's 5:30 sharp on my watch. So I'm presuming we are on track here. Over to Robert Clive.
Yes, Dr. Bhattini, you have taken us through a big journey, but in your own inimitable, very beautiful, simple style. And more importantly, truly, you have given an international dimension to this international webinar by bringing in a big experience. But as I said, in a very simple terms, I have put it. In fact, I was just checking the chat box. People already started reflecting what you said and said, can we do this wellness warriors in our schools? Which means it has created an impact among the audience. And you have put it, how we can translate a practice, which happened in a crisis into a school setting or in a college setting, how we can reach out to the last person. I think that message was brought out very clearly, but I just want to salute you for one reason. As usual, you are a truly a great teacher. You know how to empower a student, to bring them to the front and stay on, hold on their hands, and also making them an equal partner, not just as a student. I think you've shown that on this stage. Thank you, Dr. Bhattini, so much for all the lessons you have taught us. And you can take the questions now over to the other host. Yeah.
Good morning.
Good morning.
This is Professor Dr. Jawaharlal from Abu Dhabi, former principal. Really, it's an excellent program and presentation. practice makes the man perfect, says Bacon. In the same way, you have induced everyone to practice the best health part. Really, it is a commendable session. I am privileged to attend that. God bless you all, and thank you very much for giving me an opportunity to Tamil Nadu Teacher Education University, Madam Miss Dr. Sakti, and also Dr. Robert Clive. They're excellent stalwarts being the organizers. Wonderful session, commendable. Thank you. Thank you.
Thank you.
Thank you, Javaga sir. Ranjani madam. Ranjani
Yes,
madam.
ma'am. Yes, ma'am.
Please read out the questions, ma'am.
Okay, ma'am. 1 second. Give me 1 second.
So Dr. Padmini, there are a
Okay.
few questions in the Q&A, so they'll read out for you.
Okay, I'll be reading question. Am I audible, sir?
Yes, please. Yeah.
Okay,
Dr.
the
Anjani, go
question
ahead.
is
Yeah.
somewhat a lengthy question. While we meet students at their home, their parents refused and didn't give support, especially girl children and poor students. Suggest some measures to convince the parents, especially in this COVID situation.
That is definitely a really good question from what the person is feeling. Like I said, you are the first link. So whoever is the person undergoing this situation, try and make the construct as simple as possible, because small is all. So at that point in time, if the parents are being partial to one child or the other, or one gender or the other, maybe from the point of view of the parent to be empathetic and see why. Why is the parent feeling that? And if we can influence having one single conversation around it with the parent and not forcing our agenda, and then saying where you are coming from and why you want what you want to do, I think would be a very good starting point. And I think it's good that we think of the ideal, because the ideal is what drives us, but not to lose sight of the construct that's keeping people together as well. So to be non-judgmental is to just accept what's in front of us without judgment. And if we can do that and really understand what is the reason behind the parents' motive, because 100% no mom or dad wants anything bad for their child. And I know many people are here from Tamil Nadu as well. And the proverb that's coming to my mind is Kaka Katan Kunji Pon Kunji. So for every bird, its young one, however ugly it is a golden little nugget in front of them. So really to be respectful around that and then check why, I think is one first step to go ahead.
What is the most important professional value a teacher should have in your point of view?
I think in my point of view, the most professional honesty comes up first, and honesty for your own self. If you can be really honest and on what your strengths are at this point in time, what you are going through, and to be really honest around what your self-care measures are is most important for a teacher. Even in the hospital situation we were talking about, all the time we talk about it's about the patients, but now in the bushfire space we've learned it's not about the patients, it's about the staff, because the minute a staff recovers in whichever form, we are going to go towards the patient. So I think from the teacher's point of view as well, what is your protection? Are you feeling burnt out? Are you getting irritated with what you're doing? Are you enjoying what you're doing? Can you look at a role model of another person and see what is it that's filling his or her cup? Learn from that situation. And I think being a lifelong learner is what the child is going to be attracted towards. And everything else that comes later, and I'm sure each speaker is saying the same thing as well, all our knowledge, all our experience, everything comes later. The first filter is how we connect. Because if that first link is missing, everything else has no value at all.
Thank you, ma'am. Next question. How should we deal with the children from single parent or broken family background? Please share your thoughts on the common mistakes we do unknowingly and how we can correct ourselves.
I think the answer is in the question. Whoever has asked this question is really brilliant because there's a lot of self-awareness in the question. So I think just being self-aware of how you look at that situation. What are your personal judgments about a single mom raising her children? Or where the family construct is broken? Are you going with value judgments over there? Going back to that little exercise that we demonstrated that Andrea did, you know, if you can go back and do your own values audit around it and then see, sort that out in your mind first. And then maybe the child will give you the clue. Just trust that you don't have to have a plan. If you've got an open heart and you're goal focused and goal oriented, what does that family want will reveal to you, and that can be the first step. But definitely, even before you go anywhere near the family, remember, if you can't do any good, don't do harm.
Thank you, ma'am. Next question. What is the best to drive enthusiasm and participation among students?
The best thing for us to do is to see how much motivation comes from ourselves. It looks like I'm repeating this again and again, but I'm saying it with a lot of sincerity. Many a time when we go into a situation with a task, it becomes very difficult. But to get people enthused is about really bringing our own skills to the forefront. Does Andrea want to add anything here? Because one thing in the SEED program, Andrea, that we've got constant feedback is active engagement. Very, very hard to engage. Groups have engaged with the SEED program. Do you have any insider, outsider views, Andrea?
I think it's the openness, Padmini. I think being open to your students or to the participants in our instance is what increases participation. It's being open during the workshops that we have in our context or in the classroom, being honest, like Padmini said. I really think those two values are what hits me, openness and honesty.
Thank you.
Thank you, ma'am. And I think it's the last question. Is it possible to implement in rural India, maximum not have internet connection or mobile?
Well, I think, you know, it's not just a rural area situation. I see it a little differently. In the wellness space, there is no substitute for a face-to-face connection. And I think there are a lot of factors in a rural area that are support factors, which may be absent in an urban setup. So not having the internet connection or, you know, not having a mobile phone may look from a technological point of view as a handicap, but maybe, you know, their psychological health is much more sophisticated. Their physical health is much more better. There is definitely a net of support that they may have, informal supports that they may have. That are very strong factors. There may be an elder in that community, or, you know, a school teacher, a person, a postmaster, whoever we are thinking of, who may be the leaders in the community. So sometimes I think, I know that COVID's given us a very different way of looking at things, and sometimes it is a contradiction as well when we are talking about you know, social distancing and everything else that is restricting us. But at the same time, if we can make an effort and say, yes, in the rural area, these things don't happen, but what are the things that are the binding factors, and try and put our focus to support that would be a very good starting point.
Thank you, ma'am. I think there are no more questions, but I like to ask one question, ma'am. I'm myself Dr. Anjani Devi. It's actually not a question, it's one of my concern. All these wellness warriors, or we call them professional healthcare persons, are they getting enough recognition from the part of our society, the deserved recognition? What do you think about this, ma'am?
Yeah, very good question. I think there's two ways to look at it. One is people are coming from a very altruistic space as well, really wanting to give, because in giving we receive. And even if you want to go into the science of everything, among all the virtues, gratitude is one virtue. It's been researched in the laboratory that gratitude is like the mother of all virtues, because gratitude gives us a double dopamine hit. It gives us a dopamine hit in receiving as well as in giving. So I think wellness warriors and a lot of people who are in that giving space are coming from a different level of altruism, wanting to give, wanting to help. Where we have to be really careful is not to drain ourselves doing it, because the need is much more than one single person. So therefore, I think we coming together as a collective is very important. And even in the wellness warriors space, we were talking about what are the lessons we can learn from a geese, you know, the flying of the geese going forward. They all take turns to be at the head of the V. And when they're tired, they go back and somebody else takes on leadership. So I think that kind of support is very important. I'm not at all denying when you don't get external recognition, it's very hard. Definitely it's hard, but like anything in life, I think it may take some time. We've had our own frustrations in Milton, isn't it, Andrea? How much frustrations we've had, and the long 2.5 hours driving back every weekend used to be like our therapeutic peer support. But now we are seeing where we just relaxed ourselves instead of being tight. You know, frustration, yes, talk about it, sit in the discomfort, but we are seeing so much more that is sprouting now that we have not expected. So giving from a very different space. Would you like to add anything, Andrea? You volunteered, so what's your experience?
About the recognition of wellness warriors?
Yes.
Yeah, I really like the points that you made, that it comes from an altruistic space. I do also agree that, of course, any recognition is good recognition, and sometimes if it's very direct, it comes across a little bit easier to notice that you're being recognized. But what I found is really beautiful that when we share these presentations across different hospitals in our district, and there's 8 hospitals, that it's interesting how different healthcare professionals who don't even know the people in Milton Ulladulla Hospital actually recognize them in that space. And the best example for me is when our colleague John Andrews had passed away about a month ago. And the Milton staff ended up being called from Bulli Hospital to support Bulli Hospital staff that they have never met, because those staff recognise the wellness warriors' skills. And I think that's the perfect example that although maybe it's not recognised the way that it should from a higher management point of view, because it is that top-down, bottom-up approach, from bottom up, wellness warriors are almost heroes to other staff. And I think that it's really special. It's great to be a part of a program like that. And I look forward to seeing where it spreads.
Thank you,
Thank you, Andrea. And when we're talking about the spread in Australia, just to give you a context, it's about 300 plus minus kilometers we're talking here. So it's almost like going from Mangalore to Hassan to do a workshop and come back the same day, thanks to good roads. But that's the distance we are covering here, because Australia is very widespread. So, you know, even just from the giving space, when we are talking about the amount of effort that's gone through, I remember picking Andrea at 5:40 a.m. because we had an 8 a.m. presentation in the morning. So really, you know, to get up by 4 o'clock and leave our homes and go and giving much more, but then receiving to that great extent as well. So a lot of things are hidden. A lot of things are overt. And one thing for us to remember is definitely that in giving that we receive.
Over to you, Premlada ma'am.
Yeah. So thank you. Yeah, I'm here. I'm here, Dan. Dr. Batmini, I think the same gentle, warm, caring, that presentation all through keeps us really glued to you. Thank you so much. I just like to really take, maybe one, message from the chat box, if you have time. And there are people,
We've 10 more
yeah,
minutes.
it's not it's not a question. I think it's probably an observation or an I think there are fans here, back here in Bangalore. And you used to come to Little Rock School, the people who are attending, one Mr. Shaji Devarajan has put it, madam, you have presented the wellness so beautifully that it has reached to our minds. The collaborative work that you had in your hospital by including all category of staff itself is a limelight for others. Thank you, madam. So quite a few messages from here. Thank you so much. So it simply means you have reached the hearts of people. So I just like to really at this point of time acknowledge two people who helped us to reconnect to you. One is Professor Matthew C. Nayan, your friend, and another is Dr. Vani Ballal. I think I should acknowledge, their help in reaching out to you.
I'm very curious whether they are whether they're listening to us, because Matthew generally doesn't keep quiet. So I'm very curious if he's listening.
But he wanted to be a silent listener. I don't know that he would like to unmute it. I just asked him this morning. But I want to really acknowledge their help in reaching out to you. Thank you, Professor Matthew Sinanan and Dr. Wani. I think, Dr. Batmini, the two takeaways that you said to all of us, from your presentation and your experience, one is that listening is to understand, not to fix. I think all of us as teachers, I think that will be the biggest takeaway. If we can listen to our children, I think there is nothing more than that we can create that first link. And the next thing that you said is, what is one small thing that I can do today? I think each day morning when we come to the office or school or college, we can ask to ourselves, I think life will be beautiful. We can make a big difference in the community around. I'm sure you have left a big mark on all of us who have attended this webinar. And I think, as you said, the biggest virtue, I heard about your virtues project as well. Now you said gratitude is the biggest one. Now we are grateful to you. I request Mr. Girish from our college, who is heading the Department of Commerce, to propose the vote of thanks to Dr. Batmini, Andrea, and everyone. Over to Mr. Girish.
Okay, thank you, sir. As we are come to the end of second day of international webinar, Every Child Matters, Reaching the Unreached, Strategies, Challenges, and Success Stories, jointly organized by Tamil Nadu Teachers Education University, Chennai, and IQAC of Crossland College, Brahmawar. It's my duty to give a word of thanks to each and everyone. Firstly, I would like to thank the Honorable Vice Chancellor of Tamil Nadu Teachers Education University, Chennai, Professor Panchanadam, respected Registrar, Professor V. Balakrishnan, Dean of Faculty, Professor Govindan, Principal of Crossland College, Professor Samuel K. Samuel, and the organizing secretaries, Dr. Shivashakti Rajammal and Dr. Robert Clive G. And I would also like to thank Dr. Padmini Pai for the wonderful session named A Caregiver's Experience of Reaching the Unreached in the Australian Bushfire Experiences and the Seed Program. So we are all got the knowledge about the science of strengths, finding our own strengths by different ways, and also a very good explanation about the seed program. Thank you very much, ma'am. The pictures which are used in the presentation made us to see the real situations of the bushfire. Thank you being part with us, ma'am. Thank you from my bottom of heart. And also I would like to thank Andrea Nuzivic for their real-time experiences sharing to the various aspects like accountability, collaboration, commitment, creativity, flexibility, etc. And also I would like to thank for giving a fantastic presentation about the project Wellness Warriors and also sharing the real-time stories about the Australian bushfire. Thank you very much, ma'am. At the end, I would also like to thank all the joint secretaries and the members who made this webinar grand success. At the end, I would like to thank all the participants for their active participation. Thank you one and all.
So,
Thank you,
thanks.
Batni madam.
Thank you.
Yeah,
Thank
so
you.
this
Thank
is
you, Andrea
Dr.
ma'am.
Thank
Okay.
you.
So, Dr. Padmini, we are missing the ever dynamic, enthusiastic organizing secretary from the Tamil Nadu Teachers Education University, Dr. Shivashakti. She had a pre-NK, it was fixed long back. She said she missed. On her behalf, we want to thank you. It was really great having both of you. Thank you so much for sparing your valuable time with us. So, I just like to wind up just with a reminder about tomorrow's program. So, it's a week-long program. I just small reminder, there's a slight change in the timing for tomorrow. It's at 3:30 p.m. Please tune in. It's again another dynamic speaker, Mrs. Vinita Rachel Verghese, who is the one who really helped me to bring this topic on table. And her topic is going to be even you can bring a change whoever you are. So I think that's going to be an exciting presentation. She comes from University of Illinois, Chicago, USA. So please tune in at 3:30 tomorrow. Thank you so much. Till we see again. Bye bye to all of you. Thank you once again, Dr. Prathvini, for being available to us. Thank you so much.
Thank you.
ma'am.
Thank you, everybody. Thank you.
Javagar
We'll be
sir,
in
thank
touch
you,
from
sir.
here.
Robert sir, thank you so much.
Thank you so much. Thanks to Dr. Ranjini also for bringing out those questions to us.
Ranjini madam, thank you ma'am, thank you.
Yes.
Shall we wind up the session, sir?
Yes. Thank you. Thank you, everyone.
Thank you, everybody. Thank you. Bye. Thanks, Andrea.
Andrea, thank you, Andrea. Thank you so
Thank
much.
you very much for having me in this opportunity. Thank you. Thank you all.
Yeah, thank you.